This conference will now be recorded.
Good morning, everyone. This is Melissa Morin. I'm a Public Information Officer with the Whatcom County Health Department. Welcome to our media briefing for January 6th, 2021. Thanks for joining us and Happy New Year. Today we're going to hear from Erica Lautenbach, our Whatcom County Health Department Director, and Amy Hockenberry, our Health Information and Assessment Supervisor and our Vaccine Planning Lead. We'll hear from each of them and then open things up for questions after we've heard from both speakers. I just want to remind everyone to go ahead and mute yourselves. And if you have questions, feel free to type those into the chat as we proceed through our briefing, and we will call on folks to ask their questions as they're typed into that chat feature. So we invite members of the media again to go ahead and identify yourself in the chat. And as a reminder, we are recording this and it will be available later today on the Whatcom County Government YouTube channel and on our media page at www.whatcomcounty.us/COVID. And with that, I am going to turn things over to Erica to start us off.
Thank you, Melissa. Good morning, everyone, and Happy New Year. Unfortunately, on January 1st at 12:01, things did not magically change with COVID, but we are hopeful that this year will be a sign of new hope and change as we talk about vaccine and a change to hopefully some more normalcy in the coming months. I first want to share a bit about the disease activity that we're seeing. We continue to see increases in rates in the last couple of weeks. We did see some leveling off in November and December, and then we are now seeing increases at a pretty high rate the last week and a half. So since the holidays, they have crept higher, and I just want to share that we will have more information about what we can attribute to the holidays probably next week. We don't know the impact of holiday events and celebrations. At this point, it's too soon, but we will be able to provide that information likely next week. We do know in terms of our case investigations that the transmission rates and the sources of transmission continue to be, as they have all through the fall, primarily attributed to social events and household activities and household contacts. That has not changed, but we will know more about the holidays next week. The increases are concerning, and we have seen our hospitalizations tick back up again. They have not seen the reductions that we had hoped for with the reduction in cases, and despite all of that, we are grateful that our case counts are lower than elsewhere in the U.S. and in Washington, and you know, hoping that we can continue to contain this virus here. We ask that people continue to stay vigilant and not take risks that could spread the virus further. The data on testing is still incomplete. The volume of testing around the state has resulted in some challenges in reporting negative test results in the state data system. So the total number of tests and percent positivity should be interpreted with caution. However, we continue to see between 450 and 550 people each day at our testing site in Linden. And we have seen percent positivity at our testing site more than double in the last 2 weeks, from around 3% to nearly 7% last week, and likely this week as well. So from our limited data, which is not the whole of the population in Whatcom County and in the whole of the testing, we do see percent positivity increasing, which is consistent with the increases in community spread in our community. A couple of other things I want to share. So we are also learning about the governor's Healthy Washington roadmap to recovery, and we are fielding questions from businesses and trying to help them interpret the guidance and the new phases. I have also reached out, given that these are regional approaches in phasing. I've reached out to my peers in our region, in Skagit Island and San Juan, to identify ways that we can communicate, we can share resources and data and information so we can help each other move together as a region. And we'll know more in the coming weeks about how this will look and how we'll be able to move forward with that roadmap to recovery. Before I turn it over to Amy Hockenberry, who's going to share a lot more information about our vaccine planning, I just want to share that we have received a lot of requests, a lot of emails from individuals who are in phase 1A or think they are in phase 1A who want to get vaccinated. And we ask that individuals do not call the health department to ask where they can be vaccinated. We are not able to help individuals find a vaccine provider. However, those individuals can talk to their employer about employer plans to vaccinate staff, and they can talk to their regular healthcare provider to find out if they are vaccinating phase 1A workers. We also encourage all healthcare organizations to become enrolled as vaccine administrators. So we do ask that individuals consult first their employer and their healthcare provider rather than going to the health department for answers. We do, however, update our website, our COVID vaccine page on a weekly basis, and we'll have more information as we receive it from the state on the different phases and who is eligible for those phases. So with that, I'm going to turn it over to Amy Hockenberry.
Hey, thanks, Erica. As Erica mentioned, I'm going to cover some information on our vaccination planning. But before we get started, we want to acknowledge that we know that many people are excited to get vaccinated and want to know how and when. And we ask that people remain patient. This is one of the largest vaccination efforts in history, and it's a complicated process from the federal to the state to the local level. So as you know, we're in phase 1A in the Washington State Vaccine Plan. And as of January 4th, there was just a little over 5,900 of COVID-19 vaccines allocated to enrolled vaccine providers in Whatcom County. Currently, we've got 12 vaccine sites that have been approved by the Department of Health as enrolled providers, and more than double that number who have pending applications that are either initiated or pending. So, and very roughly, we estimate that there are about 14 to 16,000 people in Whatcom County who likely fit the criteria for phase 1A, tier 1. So this means Whatcom County has received only 37% of the estimated amount needed to vaccinate phase 1A, tier 1, not including long-term care facilities. We are eager to begin reporting the number of vaccines that have been administered in our counties, but however, at this time, we're unable to do so. The COVID-19 vaccination data is reported by vaccine providers into the same immunization data system that the Washington State uses to track other vaccines. It's not directly reported to the local health department. At this time, we're not confident that the data reported for Whatcom County is accurate, but we're working to improve it so that we can share regular updates into the future. I had mentioned a tier 1 and just announced last week, now in phase 1A, there's 2 tiers. So the first tier is meant to be completed first and includes healthcare workers who are at the highest risk of getting or passing COVID-19. So some of the examples are caregivers or other workers with direct patient contact in settings like the hospital, home health care, assisted living, skilled nursing facilities, our urgent care clinics, and then our COVID-19 testing sites. It also includes our paramedics and EMTs and residents of long-term care facilities. Tier 2 includes all other healthcare workers that are not in the highest risk groups. So there's been some confusion and misinformation about how to know if someone's in phase 1A and which tier they might be in. So I want to be clear that it's not the job of the health department to determine if any specific individual is eligible to be vaccinated in any phase. The decisions about which types of people are in which phase are made by the Washington State Department of Health. The criteria and the guidance that the Department of Health are spelled out so that the vaccine administrators can determine if workers fit into a phase 1A group, and for them to prioritize vaccination of their own staff. We're receiving many questions about how people in phase 1A can be vaccinated, so we also want to clarify this. Enrolled providers receive vaccines directly from the Washington State Department of Health. Providers who have phase 1A workers, like Peace Health St. Joseph Hospital, are vaccinating their workers, and the Whatcom County Health Department isn't involved in any part of that process. Some long-term care facilities are enrolled in the federal partnership program with some major pharmacies, and others long-term care facilities have contracts with local pharmacies to provide vaccinations to their staff and residents. Phase A workers who don't work for an enrolled provider or a long-term care facility with a contracted pharmacy can be vaccinated by an enrolled provider. For example, the Bellingham Fire Department EMS workers and the Whatcom County Health Department phase 1A staff have been vaccinated by Peace Health. The health department is not keeping a list of phase 1A workers who have yet to be vaccinated. What we're doing is we're coordinating with the larger medical groups and healthcare providers in our community who can collaborate to offer vaccine clinics for those phase 1A workers, regardless of where they work at. Healthcare providers, they have the staff, they have the appropriate clinical setup, they have the skills to do this type of clinical work. What's also good about this time period is while there's a relatively small priority group that can be vaccinated, this is a great time for our vaccine administrators and enrolled providers to work out their kinks, work out their plans, and gear up for more broader vaccinations as the supply increases. So our role has been to host these conversations for co-planning among the medical providers and pharmacies in our community. And we're really pleased with the way our healthcare partners have stepped up for this really incredible effort that has literally just begun. I do want to mention a tool that DOH is going to be providing here very soon. It's going to be an online tool that's going to allow people to answer a short series of questions that will help them determine which vaccination phase they're in. And again, it's important to remember that the Whatcom County Health Department does not have a role in verifying who's eligible to be vaccinated. Some vaccine providers may choose to have a verification process. As Erica mentioned, we really encourage for individuals who are in phase 1 and want to get vaccinated to do some of those items she mentioned. Check the guidance from DOH, determine if you're in tier 1 or tier 2. We ask that they talk to their employer about the plans to get vaccinated, talk with their regular healthcare provider, and as Erica mentioned, continue to check our website. And then we are, again, Erica mentioned this, encouraging and eligible entities to consider enrolling as a provider. So health providers and pharmacies can check the State Department of Health's website for information on how to get enrolled. And as for timing and moving forward in these phases, so we expect to be in phase 1A for several more weeks, and next up to be vaccinated will be phase 1B. Some examples of groups who are recommended for inclusion in 1B are teachers and other school staff, essential workers such as grocery store, post office, public transit, law enforcement, and people over the age of 75. We're anticipating announcements from DOH soon about group phase 1B, and the Department of Health will also determine when we move into phase 1B. So everyone, just to wrap up, everyone who wants to be vaccinated will have the opportunity to be vaccinated, and as we said previously, it will take many months before vaccines are broadly available. So in the meantime, we encourage people to stay patient, keep masking up, spreading out, and staying safe. And I will end it there, and I think I'll pass it back to either Erica or Melissa.
Thanks, Amy. Thanks, Erica, for sharing with us. We'll go ahead and open up the floor for questions. So again, a reminder, if you members of the media, if you would like to ask a question of our presenters, please go ahead and type your name and affiliation into the chat, and we will call on folks as those questions roll in. Like our first question is from Tom Bonsi with KOW. Tom, go ahead and ask your question.
Hi, thanks. Happy New Year as well. Question for Amy. Do you anticipate doing any mass vaccination clinics that would be separate probably from the hospital?
Yeah, as I mentioned, our role at the health department right now, first and foremost, is to coordinate and collaborate with our medical providers. We understand the massive undertaking of vaccinating thousands, hundreds of thousands of people in our county and over the next several months. So first and foremost, we'll be looking to collaborate with our medical providers to see if there's ways to develop mass vaccinations, and then the health department would be looking to fill in any potential gaps or needs and capacity in that respect.
And then just a quick follow-up from your timeline of when to go from 1A to phase 1B. Sounds like late January is your best guess at this point?
Yeah, again, that will be determined by the Department of Health, and that is the closest timeline that we've been given at this point.
Thank you.
Our next question is from David Rasbach with the Bellingham Herald. David, go ahead and ask your question.
Good morning. Thank you for speaking with us, Erica and Amy. Erica, have you seen an increase in the number of people showing up at the county testing site? We heard some reports that there may have been a longer than usual line up there this week.
We have been maxing out our testing site and have had to utilize some overflow testing slots. There is very high demand for our testing at the moment.
Thanks, Erica. Our next question is from Joe Tehan with KGMI. Joe, go ahead. Joe, if you're there, you can go ahead and unmute yourself to ask your question. If you don't have access to audio, you can also type your question into the chat and I will read it out.
Sorry, I turned on my mic and I didn't unmute myself. But a question for Amy. As far as long-term care facilities, is the state health department determining who gets vaccines when as among those facilities? And also wondering about senior living facilities, those kinds of, are they in that same category as long-term care facilities?
Yeah, so for the first question, actually the pharmacy program is at the federal level. And so they have a partnership with CVS and Walgreens to match these long-term care facilities that have enrolled in that program to get vaccinated and then scheduled. And then for timing, I'm not aware of the specifics of when their scheduling is. They are doing this nationally. And then for the facilities or adult senior living, they unfortunately, some of them don't qualify for that program. So that is an area within our health department that we're working with those entities to get them set up hopefully with other enrolled providers so that they can be vaccinated as soon as possible. As more vaccines become available, the supply is quite limited at this point.
Thanks, Amy. Our next question is from Pat Grubb with the Northern Light and All Point Bulletin. Pat, go ahead.
Hi, thank you very much. Due to the border closure, Point Roberts presents particular challenges to a vaccination program. Has there been any discussion on how vaccination will work for Point Roberts residents? And two, 75% of the firefighters in Point Roberts actually are Canadian residents who cross the borders. Would you expect to provide vaccinations for them before the rest of the U.S. residents there?
Erica, do you want to take this?
Sure, I can take a stab at it. We are in close communication with Chief Carlton up in Point Roberts, and we are providing some technical assistance to ensure that their first responders and, when applicable, their residents have access to vaccine.
Thank you.
Our next question is from David Rasbach with the Herald. David, go ahead.
Hi again. Both Erica and Amy mentioned that people who want to know more about when they can expect to be vaccinated should either contact their employer or their healthcare provider. As we get closer to further tiers, who are you suggesting the employers speak to find out information to give their employees?
That's a great question. And I'll take a stab at this if Erica can fill in too. You're right. There's a lot more employers that are not going to be potential enrolled providers for obvious reasons. And so, it's an interesting question to answer because we don't know where we'll be in 3 weeks or even in a month from now. And so, at this point, yes, I would encourage employers to be reaching out to the health department, but not individuals within those groups, so we can help guide processes. And then employee health as well, and occupational health is also where we would want to point individuals and their employers. Eric, I don't know if you'd have anything you would want to.
Sure, and I think it's worth noting, if you're not aware, there are concerns about safety and security among enrolled providers who receive vaccine. And so unless they are volunteering their name or their location to the public, we are not able to share that information. So that's where it becomes a challenging exercise when people call us. We can't exactly tell them, oh, go to this pharmacy or go to this provider, which is why we want to see it at a system level rather than individual by individual. And as there's more vaccine available, we're hopeful that that there will be more providers, and more providers will feel more comfortable sharing that they do have vaccine and they're able to vaccinate folks. But at this point, there are concerns about safety and security.
Our next question is from Tom Bonsi with KUOW. Tom, go ahead.
Hi, yeah, this could be for either Erica or Amy. I'm hearing more concern statewide now about the relatively low percentage of vaccines that have already been received getting into people's arms. What is your sense in Whatcom County of where the bottlenecks might be?
Yeah, I can take a stab at this too, Erica, and if you want. It's a multi-pronged answer to this. We just even think about the situation on hand, right? As providers are receiving vaccines, they are simultaneously figuring out plans. There's clear protocol about how these vaccines need to be handled, stored, and then administered. So they need to make sure that their staff are trained and ready to receive these vaccines. There is a process as far as, and you're probably all well aware that both of the current vaccines are known to have some level of side effect. So there is scheduling of staff and rotation of staff in order so that they are not clearing out an entire shift. And then as these providers are also preparing to hold large clinics, and so they're building these plans as well to hold large clinics as well as they're receiving vaccines. So there's just a lot of planning efforts underway while simultaneously the vaccines are starting to trickle in. So that's just some of the understanding and situation that I'm aware of.
Yeah, and I guess I would just also add that for those that have developed those systems and processes, they're ready to accept more vaccine, and they have figured out systems in order to be able to vaccinate people in a short period of time. So I think there's a ramp up period, as Amy described, but we do see that there is healthcare readiness to receive more vaccine, and unfortunately, the vaccines that we have hoped for have not materialized. It's just been just a challenge, I know, statewide and nationwide in terms of getting vaccine to people and to communities.
Our next question is from Joe Tehan with KGMI. Joe, go ahead.
Yeah, kind of a follow-up to that, where we were just discussing. Are you getting any indication when you'll be receiving vaccines, or is it sort of a waiting game?
Well, both. Right now, the Department of Health, their operation is week by week, and that is based on how the CDC is distributing. So there is a process of ordering and as an enrolled provider, a process of ordering and signaling a willingness to receive for the following week. And then there's an ordering process from the Department of Health. I don't know if it's an ordering process. There's an allocation process between the CDC and the State Department of Health. So it is on a week-to-week basis. And what we've heard from the Department of Health is that they are learning by each week how much the state will allocate, and then they're walking through a distribution process to enrolled providers throughout the whole state.
All right, we will do one last call for questions. Thanks to both Amy and Erica for taking the time to share with everyone today. And I don't believe that we have any. Oh, great. We have one more question from Tom Bonsi. Tom, feel free to unmute yourself.
Hi, thanks. I'm just curious if the health department has been directly lobbied by any industry groups or associations trying to get themselves into a higher tier. And if so, can you mention maybe who is most persistent, or which categories of people are most persistent in wanting to get on your radar?
Well, I think, of course, there are lots of people that have potential risk to COVID that work in different sectors. However, because our health department is not responsible for making decisions about who falls into what tier or what phase, we have not seen direct lobbying. I would challenge you to ask the State Department of Health, because I'm sure they have more information on that than we do. But it's pretty well known that we're not responsible for making those decisions. So
I have asked the State Health Department, and they're getting a lot of lobbying, as is
yes, I'm sure.
And it's kind of interesting. The trade-offs are not easy. Do you vaccinate a 65-year-old with underlying health conditions before or after a convenience store clerk who, in one case, seems to be in 1B and the senior in 1C? So anyway, I'm glad I don't have to make decisions.
Yes, there's a lot of imperfect decisions, and this is certainly one of them. But we have a lot of faith and trust in the State Department of Health to really think through how to assess risk and concerns about increased morbidity and mortality among these populations, and make decisions based on that.
All right, and one more question from Joe Tehan with KGMI. Joe, go ahead and ask your question.
Oh, okay. I was just wondering if you've had any reports of any side effects, especially serious ones, among local folks who have gotten the vaccine so far?
I can say we haven't. Amy, I don't know if you've heard anything, but nothing other than the sort of usual anticipated side effects, soreness around the vaccine site, and potentially some fever or chills like you could experience with any vaccine. Amy, I don't know if you've heard anything either.
No, I have not heard anything.
Okay, thanks.
All right, thanks everyone for attending. We're going to go ahead and close things out for today. And again, you can look for this recording on our website at www.whatcomcounty.us/COVID. Thanks and have a great day.